All right, guys, if you guys want questions, I'll be glad to. This might be the easiest way for us to do it.
Governor Cooper, Grace Holland with WFMY News 2. I'm going to take this down so you can hear me.
Okay.
Wanted to ask you, after seeing this tour today and seeing what home health is doing here, is there anything you're looking at you can do to make this treatment more accessible throughout the state?
Well, I think that they are providing a model of outreach to the community. One thing, we want to keep up the supply. And we get our supply from the federal government, and we're dispersing it throughout the state, and we're trying to do that in the most efficient way. But we like this outreach to community and being proactive about it. Because even though monoclonal antibody treatment has been around for a while, it's relatively new that we have a lot of it out there, and I think the data has come back so positive that it is really effective. So we're putting it in overdrive, so to speak, because we know it can keep people out of the hospital. So we like what's happening here. It's one of the reasons I wanted to come and to pat everybody on the back here. Often in the Triad, and Greensboro particularly, we see a lot of leadership, and we're grateful for that. But this outreach, personal outreach to people, particularly in underserved communities who don't have good access to health care now, this can matter a lot, and it can save lives. How important it was for me to see
yes.
To be able to walk in and see the actual room where it happens, to see some of the nurses who give the treatment, to wear the equipment that they have to wear. I think it gives me a good experience of what happens here. And I want to put this in the spotlight as well. One of the reasons that I am here is because when organizations like yours put this out on the news, more people hear about monoclonal antibodies. And unfortunately, every day, lots of people are getting positive results. So many people hadn't thought about what they would do if they're positive. And when it comes to monoclonal antibodies, treatment within the first 10 days after a positive diagnosis is really important. So we want to get the word out that this is something that you might qualify for. We want this treatment to be available to everybody, and I'm here for that reason. And I didn't say earlier, but I'm encouraged, but we're still persistent on what we're doing, that we are seeing a leveling off of our cases, of our hospitalizations, of people in the ICU. It's still unacceptably high where we are right now. But we are leveling off, and that's a positive thing. And I attribute that to people being more careful, people layering their protection, people getting vaccinated. So we've still got a ways to go, but there's light at the end of the tunnel, and we got to keep striving toward that light. Yes?
Governor Cooper, you and I had to put on the whole headset. Will you just kind of walk us through what that was like for you to wear it? What were your thoughts on the equipment, just all of that?
My first thought is that I am in awe of people who do this all day and who are willing to put themselves out there to wear all this equipment, to treat people who have COVID. So you are at risk of a highly contagious disease. This Delta variant is so very contagious, and it just gives you an additional appreciation of the work they do. I'm already deeply grateful for what they do, but to walk in their shoes even for 5 minutes provides a realization of what they have to go through, and I'm just grateful for them. And I want to encourage people to get into the healthcare field. It's one of the reasons why in the budget I'm fighting for investments in education, community colleges, universities, so that we can train people to do these jobs. I know Dr. Cagle's got a long list of openings that she's ready to fill right now with good paying jobs for people in the healthcare arena, and you can give your life to helping others, and it's one of the most important needs that we have in our state right now.
Governor, if I could go off topic, forgive me. Okay. A Republican lawmaker tells me they are confident of reaching a budget deal with you this year because you are no longer making Medicaid expansion a prerequisite to getting a deal done. Is that true, sir?
But first, we've never made it a prerequisite. And second, it is an issue that is of vital importance to me and the people of North Carolina. And I've been assured by Senate and House leadership that all issues are on the table. And I have agreed on that as well, because there are a lot of things in the budget that I don't like at this point, such as tax breaks for corporations and the wealthiest among us, and private school vouchers and things I don't like. We can find a way forward if we're all willing to listen to each other. We've got the resources now to do things that, both sides really want to do. So I'm encouraged that we will probably enter into an unprecedented situation of a real negotiation between the legislature and a governor before the budget is presented to the governor. That's the right approach here. If I have to veto this budget, I will, but I don't want to do that. And I don't think they want to do that this time. So I'm encouraged that we can have these conversations, and I look forward to it. And Medicaid expansion will be a very important issue that I'll be talking about with them.